goal, that is improve maternal health. We decided that we don't want to make you we don't want to make this boring, so we are not going to speak about numbers and statistical data. We are going to explain this goal with a nice film that, of course, we made. And after it, we are going to play some theater for you. So please, lights off.
We are in here to present the 50th Millennium Development Goal, that is to improve maternal health, and so to reduce by 3/4 the maternal mortality rate and achieve universal access to the reproductive health by 2015. In poorer countries, the day a child born is all too often the day his mother dies. More than 350,000 women die every year from complications of childbirth. 99% of these cases happen in developing countries. Please, let me introduce you to two mothers from different countries. Miss Helen Smith from UK. Hi, welcome to our program. And Miss Alirafe Chitenji from Malawi. I'm going to ask you a few questions about your maternity. Miss Helen, when did you find out that you were pregnant?
I found out because I didn't get my period, so I was worried and went to the pharmacy and bought a pregnancy test. After taking it, 2 red stripes appeared, and that's how I knew I was pregnant.
And what about you, Miss Salinafe?
I was working in the fields and I was vomiting. I wasn't feeling very well for a long time. The combine of those symptoms make me realize that I was pregnant.
Miss Helen, what has your experience been during the pregnancy? And if you have had any complication, how did you deal with it?
Well, at the start I was very nauseous, vomiting all the time, so I was worried and went to the doctor, but he told me it was normal in the first 3 months. Also through my pregnancy, whenever I've had any questions, he's always been there to answer them for me. And I also received vitamins from my midwife and attended pregnancy training exercises.
And in your case, Miss Salinafe?
During my pregnancy, I had a lot of pain in my back. I couldn't walk and I have to work a lot because work is very important. Without my work, I don't earn any money. So I just keep on doing the same, my work and everything, despite the pain and other problems that I had.
So the doctor was looking after Miss Helen. However, Miss Salinafe had no choice than keep on working. Around the world, women work more hours than men and are responsible for most of the child care and home maintenance activities. 80% of farmers in Africa are women. Let's go back to the questions. Miss Helen, do you know what are the symptoms if you are pregnant?
Yes, of course. I learnt all about pregnancy when I went to secondary school. And also through my pregnancy, whenever I had any questions, the doctor was always there to answer them.
And you, Miss Salinafe?
I knew I would throw up and my breasts get bigger and also my belly. That's what my mom said to me.
As you know, the secondary school play a great role in terms of human development. How often did you go to hospital, Miss Helen?
Well, in the end, I went once a week for a checkup.
For me, hospital is far away. It's around 40 kilometers, so it takes 8 hours to go there and come back. Really, it's not an option. There's a midwife that lives close by, but I have to work very much at home and at the field, so I don't have the chance.
As you can understand, the long journey put Miss Salinafe off than going to the hospital, and the busy daily work put her off than going to see the midwife. How many children do you have, Miss Helen?
Little Sarah is my firstborn.
And you, Miss Salinafe?
This is my second-born child who survived. Before, I had lost 2 during the pregnancy.
I'm really sorry for your loss, Miss Salinafe. How old were you when you had your first pregnancy?
I think I was 15 years old.
And how old are you, Miss Helen?
I'm 34.
How was your birth giving, Miss Helen?
It was a bit complicated, but thanks to the surgical assistance, everything turned out well and little Sarah is nice and healthy. After the delivery, the first 3 days, she was put in the incubator, but now everything's okay.
And how was your birth giving, Miss Salinafe?
I gave birth at the bushes the second time. I was coming from the lake and I had a really terrible pain in my belly. My legs were wet. I thought I pissed, but it was a baby coming.
Almost half of births in developing countries take place without the help of a skilled birth attendant. Who was in the hospital with you when you gave birth, Mr. Ellen?
Oh, everyone was there. My whole family, my husband was also there, and the doctors and nurses were also supporting me.
And in your case, Miss Alinafe, who was with you while you were giving birth?
This time I was alone, but I had a first experience and I knew what to do.
In sub-Saharan Africa today, about 60% of women who want to avoid a pregnancy are not using family planning or rely on a less effective traditional method. Miss Helen, did you plan to have a baby? How do you contribute towards unwanted pregnancy? Have you ever considered an abortion?
Well, little Sarah was planned. I planned it together with my husband, but before this, we used condoms and birth control pills. But I know that if in any case I fell pregnant and I wasn't ready, an abortion is always an option.
And in your case, Miss Alinafe?
God doesn't allow us to have an abortion. Getting a child is a gift from God.
Nowadays, in 14 states in Africa, abortion is illegal under any circumstances. Every year, about 5.5 million women in Africa risk their lives when they decide to terminate a pregnancy. Drinking bleach or inserting sharp objects into the cervix are only two of the horrifying methods they use. These are no risks any woman should be forced to take. Last question for you, Miss Helen. Do you see an improvement in the mortality of mothers and children in your country?
Oh yes, of course. If I compare to my grandmother's times, nowadays there's practically no risk in giving birth. Our social system is improving a lot and we have a very high health security system.
And what about you, Miss Alinafe? What's happening in Africa?
So little by little, not every woman is dying for giving birth. Now we have started to have family plans and also better health conditions. So now more children are alive and mothers are more healthy and stronger.
Thank you very much, Miss Helen.
You're welcome.
And Miss Alinafe, for sharing your experience with us. It has been a pleasure to learn about their life. As you can see, the differences are obvious. There is still a lot more to be done. Maternal mortality remains unacceptably high across much of the developing countries. We are still in time, but it's time to act.